With the coronavirus pandemic forcing many Australians into lockdown, concerns have been raised about the possible impact on people's mental health. Social isolation has been a real struggle for many, as people cannot do their usual daily activities and unable to visit family and friends. In response, mental health professionals and services have been working on strengthening and expanding their support systems to better help their clients during these times. Mark Culkin is a clinical psychologist in Milk Park that has worked in the community for more than 13 years. He works with a wide variety of adult clients, specifically male adolescents. During the pandemic, he has been supporting his clients by listening and providing them with key information.
As a clinical psychologist, I'm attempting to support people. Oftentimes the primary way of doing that is by listening to them and validating their experience, offering them different perspectives on what it is they're reporting.
But maintaining social connections is not always easy. Across the country, community support programs have had to go on hiatus to comply with social distancing rules.
In many ways, it's similar to what I've been doing previously, looking to listen and validate. Definitely looking to offer people a connection and indeed resources about how they might be able to get through this time. Some of those resources include from the website of the Australian Psychological Society, which has some tip sheets on maintaining your mental health during social isolation, things that you can sort of do in relation to setting a daily routine and looking to maintain the social relationships that you have using the technologies that are sort of available, having fun and making sure to look after ourselves, seeking additional support when we sort of need.
Anne Cole is the coordinator at Newbury Child and Community Centre in Craigieburn. This community service holds programs that involve social support and education for preschools and families. They also connect with other programs with older groups. As a community leader, she does not directly assist the welfare. However, she explains that the shutdown of the service has impacted the families and children.
Because of the clients being in that most vulnerable category, I don't see them coming back until the centre's pretty much clear. Most of the ones that come in, they're 80 plus and you don't want to start anything because you don't know. And I mean, we have lots of kids, but they don't mix with the other group except when we're doing joint programs. But you don't know, you can't take that risk.
Mark explains that maintaining relationships are important and that we need to be offering support to others, especially those under stress.
And so all the support that anybody can provide, whether it's a government, whether it's communities, primary health networks, councils, families, is useful.
If this piece has caused you any distress, you can talk to a GP or health professional, or contact Beyond Blue on 1300 22 4636 or Lifeline on 131114. This is Pam Kirikaitis reporting back to Will and Nadia.